Alrighty, folks. Good afternoon. I am Andre Riley, your Executive Director of Communications here in Baltimore City Public Schools, and I want to welcome you to our community information session on COVID-19 response and in-person learning, among other things. First, I want to apologize that we're about 10 minutes, 11 minutes late. We typically like to start on time or end on time, but you all know technology. I think living in the space with a lot of virtual meetings over the last 2 years, there'll be hiccups from time to time. But the great thing is we made it, and we're going to have a great discussion tonight. Again, we're here to talk about the district's COVID-19 response and in-person learning. Listen, we know there have been a ton of questions and a ton of feedback since we've returned from winter break on January the 3rd. There's a lot of new information out there. There's a lot of new guidance. And while we're posting information and we're sending you things, there's just no substitute sometimes for just good old-fashioned dialogue. So that's why we're here this evening. You can't see anybody on screen but me right now, but I'm here with district leaders and experts, where we're going to do three things tonight. We're going to have a great opening from both our board chair and our CEO, who will be at the mic shortly. Then we're going to go through a really quick recap of the things that we're doing right now in the health space. Now, it'll be a deck. I got to warn you. We know that you're not here at 5:42 to watch us give a very long PowerPoint presentation, but I promise you this one will be short and it'll be worth your while. And then we're going to have a moderated Q&A, which is kind of different. If you've been with us before in this space, what we've done is we've tried to answer everybody's questions who would post them to the chat. That's not really efficient. So tonight we're going to do something a little bit different. Before the meeting, we asked that you would submit questions, and many of you did. We had a lot of great questions as part of the reason why we were late, just making certain that we're able to get everything answered appropriately for you. But we're also going to take questions in the chat. Now, I want to be clear about what that means. Again, we're not going to address one-off questions. I've got my communications team with me. We're going to look for themes, groups of questions that we can answer on different topics. We think that'll be more efficient, and we'll also be sharing some resources with you throughout the event. So with that said, I've talked a whole lot in the last 2 minutes, so let's get the party started. We're going to start with our board chair, Jeanette Richardson. She's joining us, not on camera, but she's joining us by phone to share some brief comments from the board. Chair Richardson, how are you doing? Come on mic for me, please.
Can you hear me?
Yes, ma'am, we can hear you, and so can our growing audience, which has doubled in the last 2 minutes. Right?
Can you hear me, Andre?
Yes, ma'am. The floor is yours.
Thank you so much. Good evening, everyone. Thank you for joining us tonight. On behalf of the Board of School Commissioners, I want to thank you for attending this very important event. After last week's board forum, it was clear that many of you have questions about the district's COVID-19 response and in-person learning. We are hopeful you'll either get your questions answered or learn how to access resources that can help. My board colleagues and I are here to listen and gain insight. We won't have a speaking role. We will leave that up to Dr. Santelises and her team of experts. But know that we are taking notes to better inform how we can support you. Again, thank you for coming out tonight. Thanks, Andre.
Thanks, Chair Richardson. Thank you for joining us. And as she mentioned, she'll be here listening and taking notes along with our other board members tonight, and they're going to use this to help them help make great decisions on behalf of our students and our school staff and just the district at large. So thank you for joining us. You can go on mute now. And now I'm going to call to the microphone and to the camera our CEO, Dr. Sonia Santelises. Doc, we haven't been here in a while, but we're back today to share some great information. How are you doing?
Yes, doing good, Andre. Glad to be here tonight. I want to thank Chair Richardson and the full board for kind words, being here. And I also want to thank each of you who have come tonight. Nearly every day, my colleagues and I speak with a student, family, or staff member about the return to in-person learning or some other aspect of our COVID-19 response. We have heard the questions, passionate feedback, and disagreement that some of you have shared about those decisions. So we're here tonight for a shared and straightforward truth. We all want the most healthy and safe conditions for all students and staff members. That's it. We want the same things. And because we're starting from that point, we need to dialogue openly, honestly, and clearly about the work underway to meet that goal. So that's why we scheduled this session, to make sure you get the latest and best information from us. We also want to directly address concerns in areas where we haven't been as clear. The rules and guidance we receive from health experts change continually. We have collected your questions and feedback, and we'll share our answers and responses. We also want to recap some information that we've provided previously. We've had some notable successes, like providing weekly testing to students and staff, better than, frankly, any school district in this state. And except for 1 week, we have avoided mass transitions of schools to virtual learning due to a lack of staffing connected to COVID-19. That's because we've worked together and because of the dedication of city staff team members throughout the organization. But we've also had some stumbles, such as the delayed outreach to you when we had to transition large numbers of schools to virtual and due to virtual and technical glitches with the COVID-19 dashboard after winter break. So we'll touch on those points, improvements, moves that we've made in those areas as well tonight. I believe that you'll leave this session better informed and you'll know where to find additional information. And for those who are less confident in our response, we are hopeful tonight's information will help grow your confidence. Thanks again for being here and your willingness to partner with us. Together, we will do what is best for students and staff, and we'll continue to manage what, again, is a often changing landscape. But thank you. Glad that you're here. And with that, I will turn it over to Andre as we move to our brief PowerPoint presentation before we take questions. Thank you.
Thank you, Dr. Santelises. And again, thank you, Chair Richardson, for those great opening comments. Now, everybody, let's get to work. And one of the first things we're going to do, as Dr. Santelises mentioned, we're going to go through a deck, which I should be sharing with you right now. And I'm going to wait for my team to make certain that I'm doing that before I get going, because right now I can't really see you all. So team in the chat, give me a thumbs up and let me know that you see my screen and we'll go from there, okay? All right, thank you, Joel, appreciate you. All right, so now, again, tonight we're going to do 3 things. We had our welcome, now we're going to do our recap, so let's get started. Before we do, we have resources, lots of them. You're going to see this information on my screen come up a whole lot throughout the event. Many times you all will ask, how can I get help with a building problem? Where do I go to get different information? Well, here's a plethora of resources. Or as the slide says, there's just lots of them. And I want you to take a screenshot, write these down. So during the event while we're talking, you can get backup information that you need. And by the way, you'll see this slide again and again. So if you don't get it now, you'll get it soon. But here, we have a lot of resources. We're updating constantly. In fact, tomorrow will look a lot different than today, but right now we're going to live in the moment. Sound good? Let's roll. Now I'm going to call to the fore Allison Perkins Cohen, our Chief of Staff. Allison, how are you doing?
Good, how are you, Andre?
I'm fine. I believe this next slide is yours. I think the next couple. So we'll roll through it, and then when we get to the end of your speaking part, we'll go to someone else, okay?
Okay, sounds good.
All right.
So I wanted to, Andre, share an update on what we're doing with our testing program. As Dr. Santelisa's shared, we have a very extensive testing program. And so last week we tested almost 44,000 staff and students, Andre. So in doing so, we saw that our positivity rate continues to be lower than what you see in the community. That has consistently been true throughout the pandemic. And so last week for our secondary schools, we had tested about a little over 4,000 students and almost 2,000 staff with a positivity rate of 2%. And then in our elementary schools, we had tested nearly 40,000, 37,000 students. I do also want to make sure that, you know, community is aware of that there was that surge that we all experienced that we read about in the news. We saw that in our data too. We test enough folks that we can see those changes in positivity rates. So one thing we saw that before the winter break, there was a positive, our positive pool average was about 3 to 4% of all the pools that we do. So remember, in our elementary schools, we test pools of students and staff, not individuals. And so the positive pool rate is not the same as the positivity rate. That's higher than the positivity rate. But before the winter break, it was only 3 or 4%. And then, Andre, the week we returned from the break, it jumped up to 49% of positive pools. Again, that's not positive individuals. The positive individual rate is lower than that, but still, that is a very significant jump. And so that, when Dr. Santelisa's talked about us having to switch a number of schools to virtual, that was why, because we saw that jump. The first full week after the return from break, the positive pool rate was 23%, and then this week it's down to 4.5%. So I think you've read in the paper, people have read in the paper that in the Northeast, the Omicron rate is going down, and we've seen that in our schools. It was very high, and it has gone down considerably. So it's a much lower rate right now. Throughout that, again, our schools always remained, the positivity rate in our schools has always been lower than what we see in the community. And so that's one reason why we really feel good about the mitigation strategies we have, Andre.
Allison, thanks a lot. Let's see this next slide. I'm a little bit out of order. All right, this next slide is, we're going to call to the fore Cleo Hirsch, our Executive Director of COVID Response, and quite possibly one of the hardest working people I've ever met in my life, because she's been doing the Herculean lift. Cleo, can you come to the camera for me?
Hey, Andre, I believe I'm here. Let me know if you can see me.
I can see you. That's great. You've got the next 5 slides, so just tell me when you're ready to switch, okay?
Absolutely. So good evening, everybody. As Andre mentioned, my name's Cleo, and I support the district in COVID response, and I'm going to go through a little bit of information before we move to Q&A. So we have shifted our protocols in line with the CDC and the Maryland Department of Health and our local health department's guidance around our quarantine and isolation times, as well as our testing and response protocols. So our goal in making these shifts is to minimize quarantine times in order to really help students, staff, and families get that continuity of learning and those routines that we know are so important for our students, and to reduce disruptions caused by COVID-19. So as a result, before the 18th, we used to have a protocol that whenever there was a positive pool at the K through 8 level, students would miss between 2 and 4 days of school, even if they themselves didn't have COVID or weren't a close contact to a confirmed case, because of the way our program was structured. Now, with some of the changes I'm going to discuss this evening, we're able to quickly isolate positive individuals and allow other students who aren't impacted remain in school and get that continuity of learning and consistency that we know students need. Next slide. So this is how the new protocol looks. When a pool comes back positive, that's a group of students who are all tested as a unit. Each student will receive an individual rapid test. If the test is negative, they're able to remain in school. And if the test is positive, they're immediately isolated in our wellness room and sent home for at least 5 days. If you go to the next slide. Sometimes we do find out about COVID-19 cases outside of our weekly asymptomatic testing program. So for example, your child might be sick and you might have kept them home and used an over-the-counter rapid test, or perhaps you got them tested at their pediatrician's office. Or perhaps the child was in school and started feeling sick and accessed the symptomatic testing program that we offer through our health suite. When those cases occur, we will do contact tracing to determine if any students were close contacts with the positive individual, and they will receive an additional rapid test. And if they're negative, they're able to stay in school. And if they're positive, of course, they need to isolate and go home. Next slide. So I mentioned 5 days of isolation or quarantine. This is the next shift that we've made to improve our processes and ensure that those that can safely be participating in in-person learning are able to do so. We made this shift after careful consideration and we did wait for the CDC to issue K-12 specific guidelines, as well as the Maryland Department of Health and the Maryland Department of Education, who recently issued 5-day quarantine and isolation guidance for the schools in Maryland. So with that guidance, we've been able to make this shift. So here's how it works for those at home who have kids and are wondering what this means. Students and staff members who test positive for COVID-19, regardless of if you're vaccinated or unvaccinated, must isolate for at least 5 days. And when we count those 5 days, the day one of your clock, so to speak, is the day after you test or the day after your symptoms start. And then you count from there, 1, 2, 3, 4, 5. Once you complete your full 5th day of isolation, that's when you can return to work. It's really important to note that you have to have no fever for 24 hours and your symptoms have to improve before you return. Unvaccinated students and staff members who live in the same household as someone who tests positive for COVID, they are not eligible for our Test to Stay program. And that's because we see a lot of transmission within households. And so it's very important that if you are unvaccinated and somebody at home has COVID, please report that information to your school. And it's important that you stay home for the full required quarantine time. Unvaccinated close contacts of a student or staff member who is positive for COVID-19 would have to quarantine unless they're participating in the Test to Stay program that I just described that has begun at the K-8 level. And just a friendly reminder that if you've recovered from COVID-19 in the last 90 days, you do not need to quarantine if you are a close contact during those 90 days, if you've already recovered. All right, Andre, I think that's it for me.
Yes, Cleo, because I just spent the last 5 seconds talking to myself. Thank you, Cleo.
Okay, thank you, sir.
All right. So, audience, you've heard a little bit about our COVID-19 response. We still have a way to go on the presentation, but I want to just take a second, let you breathe, let you, again, absorb all that information that we just shared. And again, we have resources on the right-hand side of the screen. If you've got questions about building problems, yes, you can put them in the chat, but you should probably send them to the facilities address, email address listed here on the page. And by the way, please tell us your school. We've been receiving emails about facilities challenges, and folks will send pictures, but they never tell us the school. So we kind of need you to do that as well. We've got a plethora of websites on any of those topics. Feel free to go to those now while you're visiting with us this evening. And we'll prepare for the Q&A that will be governed by the basic agreements on the left. So again, take a screenshot of the resources, start to visit them now. And in the meantime, before we go, I've got to address this question from Craig Hinton. I told you guys we weren't going to do one-offs tonight and I was going to look for themed questions. Well, you have to give me some grace because I just couldn't resist taking this one. And it has nothing to do with tonight's topic, but Craig's a student and he wants to know, will there be school tomorrow if it snows? And Craig, I'm going to tell you what I tell other people when they ask me. We will tell you as soon as we have an answer. It really depends on the weather report. But I thank you for asking because sometimes folks just don't ask questions straight up like that. So Craig, we'll let you know, but right now, I think I'd plan to be at school tomorrow. Okay, moving on to the rest of the deck. We have our COVID-19 dashboard and consent forms. Chief Perkins-Cohen, I believe the slide is yours. Can you run us through it real quick?
Sure, I'd be happy to. So I know we had concerns about the COVID dashboard, and we definitely had some technical issues with the dashboard and got a little behind with the dashboard. The dashboard, Andre, is now back up and running. It's active again. I want to remind folks that the results from that first week of January 3rd, when we did a lot of testing, those results will not be added to the dashboard, because those would be cases that people contracted when they were on break. The dashboard is talking about cases when we were in school, and those were not cases that occurred when we were in school. So the increase is also, I just want to keep people in mind, that increase we've seen, that surge in cases in the last couple of weeks, it does make it hard for us to keep up. We are more caught up than we have been, but that is always a challenge to keep up. We have to actually validate these cases, Andre, before we put them on the dashboard. So we, especially in the pool testing world, we want to really make sure that we have confirmed the cases before we put them in the dashboard. And so that's why there's sometimes a little bit of a lag, but it is up and running, and there'll be regular updates to the dashboard. On the consent forms, this is a really good time to remind folks too that please turn in your consent forms. This is a really important way to, testing is a really important way to make sure we're keeping our families safe and our students safe and our staff safe. So please, if you have not already, please sign your consent form and turn it in for your students. Andre and the IT team have been doing work to try to make that more accessible. I know we heard from folks that it was difficult, that it required you to print out forms at home. I know my household is not so good at printing things out at home, so we tried to make it a form that you can actually fill in and email to us. So I hope it's more accessible now. We'll keep trying to work at ways to make it easier, and hopefully please turn it in so that we can make sure that we're testing your child when we do our testing program.
Thank you, Allison. I appreciate you. And we did get a question on this. We're not going to answer it right now, but I just want to let the public know, yes, we did get your submitted questions, and this was an important topic. My next speaker, and we've only got 2 slides left, is our Chief Operating Officer, Dr. Lynette Washington. Dr. Washington, can you come to the microphone and the camera for me?
Yes. Can you see me, Andre?
I cannot, because I see Allison's symbol. I'm going to wait for you to come about. All right, I might need a little help from my team on this one. Team, can you all see Dr. Washington before we get started? All right, there you go. So I just can't see you based on the way I'm sharing my screen, Dr. Washington. It's good to have you here. Now, before you get started, Dr. Washington, we received a question. I'm going to jump the Q&A a little bit because this is important. There was a mention in one of the questions of, what have you guys done for 18 months with air quality? What have you done to protect students? So I think this slide addresses that, right?
It does. It does.
All
And so I'll just start off just with the reminder that one of the things that we did was we decided to upgrade our filtration, parts of our filtration system, which is basically our filters in our buildings. And so during the time that our students were not in the buildings and they were not occupying buildings, we had a team, which is our mechanical services team. And I just want to give a shout out to that team because they have been working tirelessly over the last 2 years on weekends, sometime during holidays, to try to get our buildings prepared for when we opened in just different times of the year. And so during that period of time, not only were we upgrading our filters, we usually have MERV 8 filters. We upgraded those filters in buildings that could take the upgrades to MERV 13 filters. We were also fixing things. We were fixing boilers, cooling towers, exhaust fans, pumps. All of those different things were going through repairs. I will say that we have probably spent well over $2 million in just doing HVAC repairs, changing out like over 100,000 filters for those buildings that did not take filters because they were old buildings and had older HVAC infrastructure. What we did was put air purifiers. So there are some buildings where you go into, you'll see an air purifier sitting in that space. We put in probably over 3,300 air purifiers in all of our different spaces. So one of the things that we do is that for our air purifiers, those filters get changed out every 6 months. For our MERV 13 filters, for those buildings that accept them, they get changed out every 3 months. Over this past winter break, We know that in some spaces, people use spaces more intensely than others. And so air purifiers may be reaching a point where the filters need to be changed out prior to the 6 months. So over the winter break, we requested for schools to just assess their air purifiers, even though they were on a 6-month schedule, to see if there was a red light flagging. And so our teams went in over winter break and were able to change out those filters. And one of the things that I want to stress is that I appreciate families who have used the facilities website in order to flag any schools where they felt that families and teachers who were flagging where they felt that filters had not been changed. Maybe it was an oversight. And so our team needed to come back and actually make sure that all of those filters were changed. And so we've had some people who've used that website, but I think one of the things I want to reiterate that Andre said in the conversation is that you have to put the school in. If you're putting in pictures or you're making general statements, our team can't go back, investigate, and review. So if you can put the school in, and if you know the location in the school, you could put the location, as much information as possible so our team can go back and review and make sure that we haven't missed anything. Go to the next slide, Andre. So the next thing I'm just going to do is a brief overview of the mask. This is also something that we've gotten a couple of questions about. We consult with our health advisory team, and there are 3 criteria that they talk about when we make the selection, and we have conversations around mask. And so it's the fit of the mask, ensuring that the mask can cover both the nose and the mouth. It's about the comfort of the mask, because if children are uncomfortable, they're less likely to want to have to wear the mask throughout the day. And then it's about the filtration of the mask. So we're talking about high filtration masks. So one of the things that we note here in the slide is about double masking. That is something that has been mentioned a lot. We provide disposable masks for those individuals who would like to double mask. There are also instances where people may require the KN95 mask because of the type of work that they're doing. We have teams who are working with students who cannot mask because of their physical disability. And so we are providing that for our staff. But we are right now focusing those masks on our staff. We have a limited supply, so we are not yet focusing on students. And also for our non-school-based staff. So we have teams of people that are going into buildings that are not teaching in a classroom space. We have a limited number of those filtration masks that can be provided if requested.
All right, thank you, Dr. Washington. I have one follow-up question. We use the term MERV 13 filter. What's the difference between a MERV 8 filter and a MERV 13 filter, just in simple terms?
Yep. So a MERV 13 filter, it's more dense, meaning that fewer particles can get through it. Whereas a MERV 8 filter, you may have different particles. And so when we did our research, the MERV 13 filter actually addresses the COVID-19 particles that are in the air.
Thank you, Doc. I appreciate it. All right, everybody. As I promised, we've now reached the Q&A portion of our event, where we'll go over the questions that you submitted to us earlier, as well as some of the ones that you're putting in the chat, and we'll try to answer those questions the best we can. I'm going to keep this screen up during the Q&A. Usually you'll see just different faces come to the camera and see 2 people talking, but I want to be a little bit more helpful this time around. So again, this slide that you see that has our basic agreements to the left, and to the right are a list of resources. Now, let me go over our basic agreements. Again, we're not here to answer one-on-one questions. However, we are looking at themes. For instance, right now in the chat, we're seeing a lot of questions about the quarantine period. So we're going to bring that back to the forefront, try to answer a series of questions around that. We're going to answer the submitted questions first. Those of you who logged into our link and submitted your questions, you're going to be first in line, then we'll get the ones in the chat. Now, to post to the chat, if you want us to address your question publicly, or your thought, or at least to acknowledge it, you have to include your name. We're not going to do anonymous postings. That's just our standard for how we conduct our chats. We want to know who we're talking to. The best thing that 2 people have is an understanding, and to have that understanding, you usually have to know who you're talking to. So just bear with us, put your name next to your comment. It'll help us greatly, and we'll know we're talking to a real person and not a bot. We're going to be really honest, and I want you guys to be really honest too, but let's be civil. As Dr. Santelises mentioned, we're starting in the same place. We all want the best thing for our students and our staff members. So we can have disagreements, but let's be honest with our truths and let's be civil. And personal items, we can't address those here. For instance, if the seat in your student's classroom is creaking, your student's classroom at Andre Riley Elementary, and you want to talk about your individual student matter, we can't do that in this space. However, you can send that email to facilities and they can address it. The facilities email address. If you've got a question about your student's IEP and how our health and safety protocols align with that individual student's IEP, you can send those questions to health and safety at bcps.k12.md.us. So again, we want to stay away from the very specific personal items and again, get back to those big ticket themes. So with that said, again, this slide isn't going anywhere, but it doesn't mean that our presentation isn't over, because it is. So we're going to jump straight into questions. And Dr. Santelises, we're going to invite you to the camera first, because this first set of questions is about the why. Why are we in-person learning? Why are we doing this? Why are we taking some of the steps that we're taking? So Doc, let me know when you're on camera, because I absolutely can't see you right now.
Sure, I'm here, Andre.
Okay.
I'm here.
Thank you. All right.
So, go ahead.
Oh, let's get started. With heightened COVID rates, why is the district engaging in in-person learning?
No, that's a question that we get a lot, Andre. And what I would say is, one, we have consensus that in-person learning really is best for young people. So we start there, and then we move to the question of, if in-person learning is best for most children, the overwhelmingly so, can we do it safely? And that's the next question that we ask. And so one of the things we've worked with Baltimore City Health Department, with the Health Advisory Group, on which the Baltimore City Health Department also sits, as well as professionals from other health institutions. We look and we say, can we open safely? Can we be in person safely? And so while we were having these discussions and getting this feedback from health professionals, one of the things they continually pointed to was the fact that with the mitigation strategies that City Schools has in place, with the level of testing that we're doing, with the masking that's in place, with the work that we've done on air filtration that Dr. Washington described, when we look at all of the mitigations that City Schools has in place, and even relative to other school districts, our health department, as well as our health advisory, felt very comfortable with saying that we could be in person safely. So that's why we're back. We monitor the rates alongside Baltimore City Health Department. And one of the things that we've learned over the last 2 years is that there are ways to be in schools safely, and also the importance of in-person learning. So that is why it's a question that we get all the time. And a lot of it is because of the things we have put in place and what we know about in-person learning. We believe and know that we can do it safely.
All right, Dr. Santelises, very succinct and clear. Thank you for that. I have one other question for you before you cede the floor. Dr. Santelises, why can't I choose if I want in-person or virtual learning for my child?
No, that's also a question that we get a great deal, Andre. So first, we did give families the option of a virtual learning program this year. We knew, my apologies, we knew that that was going to be a limited option. Those spaces are filled right now. We are reviewing options for this coming year, but it's also important to know that one of the things that we've said continually is that virtual learning program really is for young people who thrive during virtual learning. And we know the overwhelming majority of students did not thrive in virtual learning. And so we'll be reviewing that, moving into the school, the new school year. I'll sit with Dr. Dabrowski and the team and see what we believe we can support. But our experience last spring with young people going back and forth just let us know that it really is, the benefits of in-person are important, and we did have limited seats, but those were seats for young people who actually thrive in that setting.
All right, thank you, Dr. Santelises. Now we're going to go to Chief Perkins Cohen to talk about the Health Advisory Committee.
Hey, Andre.
Hey, now, Allison, we've received a number of questions about the role of the Health Advisory Committee here in city schools. So my question to you is, Allison, what is the Health Advisory Committee and how do we interact with them to make decisions here in the district?
Great. So we're really fortunate to have this committed group of people who has been advising us since the early days of the pandemic, Andre. So we have epidemiologists, we have public health experts, we have people from the health department, from Morgan State University, from University of Maryland Medical System, and from Hopkins. And a lot of these people have very specific, in addition to their health expertise, they have school-based experience. And so we meet with them every other week, and we go through the guidance that has recently come out from MDH or from CDC and talk about how we should adopt that in a city schools context and what makes sense. We talk about current trends in the virus. We talk about our standard operating procedures and what we should have in place. They advised us on the creation of our testing program and modifications to it. So it's a group of experts in the field who we can go to and can really engage with to help advise us on how do we make sure that we're keeping our schools safe. And so we're really fortunate to live where we live and to have so many experts in the area who we can rely on to give us that advice.
All right, so to be clear, Allison, this isn't a committee that's telling us what to do or mandating to city schools, right?
No, they discuss recent guidance with us. They help advise on things that we should consider in adoption of it. We ask them questions about things that we're seeing and how we should address them, but they do not make any decisions. We use their advice to inform our decision making, and we're very lucky to have them, but they are not decision makers. They are in a consultative advisory role that is there for us and very helpful.
Thank you, Allison. I appreciate you. All right, and if you have questions about who is on that Health Advisory Committee, here on the screen, you'll see under General, here on the right side, under Resources, BaltimoreCitySchools.org/2022 Health/updates, or Health 2000, you can see it under General, 2022-Health-updates. There you can access our health and safety page, and that'll give you a list of our Health Advisory Committee members that Chief Perkins Cohen just spoke about. So pardon my stumbles, but I eventually got it out. Now we're going to move on to our Chief Academic Officer, Joan Dabrowski. Hi, Joan. How you doing?
I'm great, Andre. How you doing?
I am doing splendid. It's great to see you. Now, Joan, virtual learning, we've been talking about that for roughly the last 5 minutes. So as our Chief Academic Officer, it's only fitting that we ask you about the future of virtual learning opportunities here in Baltimore City Public Schools, starting with the virtual learning program. My first question to you, because I want to assume that everybody knows what our VLPs are, what are our virtual learning programs?
Yep. So just to follow up a little bit with what Dr. Santelises has already shared tonight. So we knew that coming back for in-person was really the best choice for most of our students. And we also learned during virtual learning, when we were all fully remote, that there were a small group of students who really did thrive, who appreciated that space of being virtual and did really well, attended well, engaged well, and did well on their reporting with their grades and their report cards. And so we built a very small program for this school year to support those learners with a virtual learning program. So currently we have 2 K-8 programs that serve about just over 800 students, and we have a very small VLP high school that serves around 400 students. And it's, again, fully remote, and it's a very specific program for, again, those students who have really shown and demonstrated their ability to thrive in that virtual environment.
Splendid. Thank you for that. Because again, there's been some confusion. When we started out in 2021, there was a lot of, you could opt into, in-person learning or hybrid or all the different things we offered. So now this is very much different, correct? Yeah, you're not opting into this. It really
is. It's a separate program. And I will just highlight too that I know some families have been asking about, well, why can't my students stay home and just Zoom into their classroom while the teachers are in school and the kids that are there can be there? What we learned last spring is that model really doesn't serve kids at home well or the kids in person well, and the trying to teach kids both at home and in person at the same time is really a challenging model for teachers, and it's simply not effective. So we don't want to go back to that model of a hybrid where some are virtual and some are in person. So I guess, that's a really important message for our community to hear, that is not going to serve our learners well in either space, virtually or in school, if we go back to that kind of a hybrid.
All right, thank you, Joan. Now, what's the future of the virtual learning programs?
Great question. So we are really looking closely at the progress that our virtual learning students are making. So we're looking at their report cards. We do middle of the year assessments. And so we look at that data closely to see, again, are those students thriving? And if they continue to thrive, that's sort of the energy to determine what we'll do for next year. So we're looking right now at programming for next year. As I think you mentioned earlier tonight, we'll be announcing that just as soon as we're ready. We're hoping it'll be in the coming month to really be able to share that and have that process earlier. We know last year it was close to the summer. We're hoping to have it much sooner in the spring this time around.
All righty, I appreciate you, Joan. I have one more question before I let you go. One of our submitted questions was, how is virtual learning helping children who don't have access to technology while they're on quarantine? How does that help them prepare for a return to in-person? That's a little bit of a choppy question, but did you get it?
Well, I'm not sure. Well, so just a couple of things. So if a student needs to quarantine and they need to continue to access and they're well enough to access their learning, they should be working closely with their schools. Every school created what we're calling a continuity of learning, so that learning keeps on happening even if a student is quarantined and they're well enough to engage in their learning. If a child is sick and not feeling well, they should not be trying to figure out virtual learning or accessing their learning. But if a child is feeling okay and wants to, schools have a plan for how those students should be accessing their classes. And in most cases, it does require having access to technology. So they should work with their teachers, work with their school principals to make sure they have a device to be able to access that learning.
Joan, you have been great. Stay tuned. I might have to come back to you, but thank you for addressing that virtual learning.
Yep.
Now, Cleo Hirsch, we have a number of COVID testing and COVID test results questions, and I'm going to need your help to answer many of them, along with our colleagues. Are you ready?
Absolutely.
All right, Cleo, we're going to start with a very clear one. What percentage of students have submitted consent forms for opt-in testing?
Sure. So approximately 2/3 of students, a little higher than that at the elementary school level, are participating in our testing program, and about 1/3 of students at the high school level are participating in the asymptomatic weekly testing program.
Right, thank you, Cleo. Now, we've received a few questions about who maintains that data. Some folks assume that it comes all here to North Avenue and it's delivered daily. I can assure you that's not how it works. So how, with our testing results, who's the keeper of the data and why do they have to have the data?
So the consent forms are documents that historically and traditionally schools will keep on file at school. For example, when you sign a permission form for your child to go on a field trip, that's a record that the school keeps at school. We are in the process of centralizing that database, but that is, typically how consent forms work in school districts. Now, the testing data is data that we do review carefully centrally, and we work with our partners at the health department. The contact tracing team reviews this data, and we use that data to make informed decisions, like the decision that we made in early January when we saw that the test results that came in over the weekend indicated a very high number of pools, and so we had to shift accordingly at some schools, while other schools, the data looked actually really good, and so we're able to keep those schools open safely for in-person learning. So there's two parts to that answer, Andre. There's the information about the consent forms, and then there's the actual testing data.
Thank you, Cleo. Yeah, I asked a bad question, but you cleaned it up with a great answer. I appreciate it.
That's okay. Yeah.
All right, Cleo, and I know you're excited about this because I'm excited about it. What efforts are we making to increase the number of students that have consent forms on file?
Yeah, so we are working hard to increase the number of students participating in our testing program. High schools have begun a lot of great campaigns to create incentives for students to participate. And our new test to stay protocol at the K-8 level, we believe, is going to be a strong motivator for the small number of families who have not yet begun to participate in testing to participate, because as I spoke about earlier in the meeting, that test to stay protocol allows for that consistency of routine for our students. And of course, you need to have your consent form in to engage in test to stay. So we're excited about the incentive that program creates for everybody to get involved in testing.
Thank you, Cleo. And I want to stay with me, but I do have an important point for you all. If you go on our website and you need to get access to consent form, you can find it numerous places through our buttons on the homepage. The links are right here for you. What's important is we have one of the best testing programs in the state and probably in the country, not just tooting our own horn. Other people have said it too, but they're not here to say it, so I'll say it. So with that said, if you need to fill out, we want you to participate. Fill out the consent form. You don't have to print it off. It's a fillable PDF. You can just go type in your answers, send it back to your school via email. It's that simple. Also, reach out directly to your schools. They'll print it for you. They'll help you. Having consent forms in means those students get tested. If those students are getting tested, we're that much safer as a community. So please avail yourselves of the opportunities, if you haven't already, to turn in your consent forms. Now, Cleo, for those folks who have turned in their consent forms and they've tested, we have one person that says, hey, Cleo, well, they didn't say hey, Cleo, but they said, hey, city schools, why is it taking longer than 5 days for test results to be returned to teachers? And why is it taking so long for the receipt of pooled testing results? I don't think it takes 5 days, but you know the truth, so I'll leave that to you.
Sure, I'm glad you asked, Andre. So at the high school level, we get our results within 24 hours. That has been highly consistent, and that's awesome. It's really hard to get PCR testing done as easily as we're able to offer it, and the results to come back that fast. So that's a fantastic resource for our community. At the K-8 level in the pool testing program, our turnaround times average between 24 and 48 hours. That is something that we actually required of our testing partner and asked for because we knew it was important for results to come in quickly. Last week, the testing results were delayed for numerous reasons that had to do with the lab where the tests are run, but we have pushed our testing partners to ensure that the turnaround times get back in check. And this week, we are back on track, seeing those results in about 24 to 36 hours. And so what that means is that if you test on a Monday, you should have your pool result in by Wednesday and can be engaging in that rapid testing to determine who needs to isolate and who can remain in school. So we are back on track with our turnaround times. It was delayed last week for numerous reasons around the lab, but we're happy to share that our partners were able to rectify that and we're back on track.
Thank you, Cleo. And for those of you who see me turning away occasionally, that's because I'm queuing up your questions to make certain that they get answered. So I am paying attention. Cleo, we have a lot of questions. What proportion of positive tests are resulting in comprehensive contact tracing within 48 hours? It's a pretty technical question.
Yeah, sure. So we did see the surge that everybody saw, and that impacted our ability to respond as quickly as we typically like to in terms of contact tracing. And I also just want to be really clear that some of those cases that we picked up in the first week in January that were from exposures that occurred over the holiday break, contact tracing at the city schools level was not needed because those were not in school cases. But right now we are really pleased to share that we have a new full-time director of contact tracing, and we have significantly built up that team, and they are working to ensure that those response times are in line with our expectations, and that folks are hearing from the contact tracing team. Schools are getting the information they need so that learning can continue and families have answers. So we're really excited about that work. We have new staff dedicated to this task, and we are optimistic that with that new staff, as future ebbs and flows of the pandemic occur, we'll be ready for it.
Cleo, you have been outstanding. These are some really good questions, but I'm glad that I've got one more, Cleo, one more. Okay. And this may not be only for you, this could be for Chief Perkins-Cohen as well. Why do schools remain open when there are positive cases? Yeah, I don't think I had that queued up for you.
I'm happy to answer, but if Chief wants to jump in, that's great.
You can take a shot if you want to. I think it's
no, go ahead, Allison, please.
So when there are positive cases, what we do is, our priority, as Dr. Santelises mentioned earlier, is making sure that we keep students in school as much as possible. And safe, that we're keeping students in school and that it's safe. And so what we do, and Chief Davis is here as well, and he does a lot of this work, is that we really look at, can the school safely reopen and be in person? So can they staff safely do they have enough staffing to be able to be open, Andre? And then also, can we do the testing that's necessary to be open? So we, again, from the mitigation strategies that we have in place, from our conversations with the health department, our health advisory, we have really layered a series of mitigation strategies that have allowed our schools to be safe places and significantly lower positivity rates than what you see in the community. And so it's the MERV 13 filters that Chief Washington talked about, and the air purifiers. It's the masking. It's that we try to social distance as much as we can. It's the comprehensive asymptomatic testing. It's the symptomatic testing. All those things are reasons why, even when we have positive cases, we are able to isolate those individuals. We do the contact tracing to isolate anybody who's a close contact, and we're able to keep our community safe and allows in-person learning to continue for young people.
Thank you, Allison. I might need you to come back. I'm hearing that there are quite a few questions on that topic, so I'm going to try to synthesize those a little bit better and ask you a good question. Thank you, Allison. Dr. Sarah Warren, can you come to the forefront?
Hi, Andre.
Hi, Sarah. It's so good to see you. One of my favorite folks in the entire organization, of which there's a lot of folks. Dr. Warren, attendance. Last week we made a big announcement about attendance and quarantines, and we've gotten a few submitted questions about it. Well, actually just two so far. So I'm going to pose one of those to you, Dr. Warren. Can absences be excused from this point forward for students that are home for health concerns, or retroactively to the week of Christmas break? I guess the question is, and I think you've seen this and I've seen this, where there have been parents that are saying, I don't want my student to be punished because they didn't attend school because they have a health concern. So will those absences be excused?
Yeah, so thanks for that. It is a question we've gotten a lot, and so I appreciate the chance to clarify. And this sort of goes back to what Dr. Dabrowski was saying earlier as well about the continuity of students learning. So to be clear, if a child is homesick and if they've got, symptoms of COVID, and frankly, if they're sick with something else, we don't want students trying to work when they're not feeling well. So those are excused absences, and our guidance has changed a little bit along the way. We've evolved it in order to make sure that we were staying consistent with all of the shifts in both the pandemic and the way that we're approaching school. But really that has never changed. If a child is sick, if they're symptomatic, that is an excused absence. And it has been going back, and it will be going forward. if we require a student to stay home and quarantine and they're not sick, if they're feeling okay, then we really, really want to encourage them to participate in learning because we don't want them to get behind. And that's where the school's continuity of learning plans come in. So it's important to communicate with your child's school to know exactly what the expectations are and what the instructional resources are and how to access those for your child. If you have any issues accessing those, be it because you're missing a computer or you can't find the right resources online or whatever it is, you should reach out to your school and make sure that you're getting the help you need so that your child can participate in learning. And we will mark them present for that time when they are participating in learning, even if they are not physically in school during those days. So our goal is not to penalize children who are required to stay home due to the pandemic. We really want to encourage ongoing engagement in learning, and we will mark students present where possible or an excused absence if they are sick. But again, that's for required quarantining. That is not sort of up for people to make their own decisions about when to keep the child home. If that's a parent's decision, as opposed to a medically required or a required quarantine, that is not an excused absence.
All right, Dr. Warren, I thought I had two, but I think you answered them both in a single shot, which is a good thing for us. It means that we're being efficient. So Dr. Warren, that's the last question I have for you. Now I'm going to call our esteemed Chief Executive Officer back to the camera. Talk about masks. Earlier this evening, well, just a little while ago, we shared some information on masks, which I'm going to put on the screen while I'm asking Dr. Santelises about that. Doc, are you with me?
I am. I'm here.
All right, great. Yeah, I absolutely cannot see any faces right now. Interesting place to be. Dr. Santelises, we've seen across the country, there's always been a huge debate, well, at least during the pandemic, about the use of masks. And do you mandate them? Do you not mandate them? How do you mandate them? Dr. Santelises, are we nearing a point where we will not have masks in our buildings or require the use of masks in our buildings?
No, it's a great question, Andre, and one that school districts minimally across the state are asking right now. As of now, Baltimore City Health Department and the Health Advisory, given that we are still in kind of Omicron surge, have not kind of made a recommendation in that direction. We're also looking to the state for guidance on that, the state health department. I will say that a number of superintendents, including myself, have been asking for guidance around this question, looking at it. We are looking at a lot of the research around masking with younger children, what that looks like, what the rates need to look like. But I will say for right now, all of the masking information we gave is currently in place for the foreseeable future. But yes, families should know that we are watching the other research that's emerging around masking of children, what that looks like. But at least as of for right now, we are on hold on that given some of the rates and where we are with the current virus.
All right. And while we're here, Dr. Santelises, there are some studies, I believe, that suggest that wearing masks impacts a student's mental health.
Yeah.
I mean, as an expert in educating students and leading an educational organization, and one that mandates the use of masks, what is our, I'm not going to say what is our level of concern, because I'm sure we have concern always for our students, but where's that on the scale? I mean, do we feel like we're harming our students by having them wear masks?
I don't think we're harming them. I mean, again, we are getting guidance from health professionals. So I'm not a health professional. But what I will say is we do know that, and there are, educators on the ground who can tell you this as well, that some things are harder to do for certain groups of students with masks. And so it's one of the reasons why superintendents across the state and country are asking this question. But as of now, given the goal of wanting to make sure that we have mitigation in place to make sure that we can safely return in person, at least for the foreseeable future, we'll have them there. But yes, I mean, I'm watching very closely a lot of the mask conversations that are going on, as well as surfacing this regularly for the city health department, as well as the health advisory. But yes, we definitely are aware and watching that.
Thank you, Dr. Santelises. Now, I'm going to call back to well, before I call my next folks back to the camera, I want to let you all know we're probably going to be here another 10 minutes, 10 to 12 minutes. We'll see how the evening goes. We intentionally did not put an end time on this event. In the past, I would tell you we would be here for an hour, and invariably folks would feel like we weren't answering their questions or we were just trying to rush off. And I don't want you to feel that way. So we're staying here a little longer tonight. Right now, we're about an hour and 10 minutes in. We'll do another 10, maybe 15 minutes. We'll see how the night goes. But again, I want to try to answer as many of your questions, especially those who took the time to submit their questions to us. Chief Perkins, Cohen, and Cleo, I need your help. I have a question about the COVID dashboard. We've not had a great experience with it in the last, since January 3rd, but it hasn't been for lack of trying. My question to you, Chief Perkins Cohen, and I think you said this earlier. What is the status of the dashboard? Is it up and running again?
Yes, so it is up and running, Andre. It is reflecting regular updates now in the data as it comes in. That data, the data that we put in that dashboard has to be verified first. So we have to verify the positive cases when we put it in. And so there can be.
Allison, you went on mute.
I'm so sorry. Sorry. Oh, thank you for telling me. I'm going on and on. Thank you. You'd think by now. I swear I went the other way. I think I muted myself when I started. Sorry. So yes, it is up to date, Andre. It is being updated now. So information that's being updated now. Those cases that are in the dashboard have to be verified before we put them in. We want to make sure it's correct. And you know, during the surge, it was hard to keep up to date with it because there was a surge. So information is regularly being updated now as we verify cases. They're in the dashboard to keep us up to date on what's going on in our schools.
Yeah, but to be clear, this isn't real time, Allison. We don't have a dashboard that every minute it changes.
That's right. It has to, again, there's work that happens to get that information in there because we're verifying the information before we put it in the dashboard.
Okay, and here's a really sharp question for us. If everyone is not testing in our buildings, then how helpful is the dashboard? What's your take? I think that's more of an opinion. Is the dashboard still an effective tool if everybody doesn't test in our buildings?
Oh, I think it's still a very effective tool, and I think testing in general is still an effective tool. We're testing enough people. We're testing a very significant portion of people. And so we again are encouraging everybody to sign those consent forms, Andre, and to make sure that we get more students tested. But when we're testing, you know, last week it was 44,000 folks. That's a large percentage of our population, and so that's really giving you a picture of what's going on in our schools. And so it's important for families to be able to see that information in the dashboard.
All right, now Allison, we have a pretty good question from a frequent writer, Melissa Schober. And Melissa, who's asked us a lot of questions about our consent forms, so we're going to try to take this one on. Melissa says, if our information on consent forms isn't centralized and is only school by school, then how do we have even an estimate of the number of consent forms that have been returned? Is that a function of, again, the number of kids we're testing?
Yeah, so we're testing a lot of students. And so one thing is that we know who we're testing. And so we have data every week from how many tests we're conducting in school. So that's one way we know. We don't collect all forms centrally, Andre, and you know that too from from the photo, what are they called? The photo permission?
Opt-out form.
The opt-out forms. Those are kept at schools. Field trip permission slips are kept at schools. The emergency cards that we all fill out, those are kept at schools. There's a lot of information that schools need to run their everyday business, and so they keep that information at schools. And so we know that we're testing students. The health and safety coordinators use that information to identify who can participate in our testing program, and we know that there's large numbers of students participating in that program. So that's how we know that we're tested, that the number of consent forms is by the way it's being used in the school to test the students before them.
Thank you, Allison. I really appreciate that. Now I'm going to call somebody to the mic who I've not called to the forefront all night. Chief John Davis. Hi, Chief Davis. I want to talk to you a little bit about the follow-up on how decisions are made at schools to transition to virtual.
Will you guys get charged? Hi, Andre.
Hi, John. I'm going to be real quick. I can't have a town hall or information session and not call you to the fore. So, John, when it comes to making decisions about closing schools, or transitioning to virtual, not closing schools, but transitioning to virtual, is it just a matter, does it have to do with the number of cases at a school, or does it have to do with staffing at the school?
Yeah, the main thing is that it's about the staffing at the school. Without a doubt, right? If we've got the staffing and we can hold classes at school, we're going to continue in that realm. And that whole time where we've had to go virtual, it's really when we've had to talk to principals and to figure out really what space every single school is. Most can go ahead and have school, but when we have cases or when we have enough staff members that are out, then we end up going virtual.
Right. Thank you, John. That's an important point. A lot of folks think that when we transition to virtual, that's a function of COVID cases amongst students. But if we can operate our buildings, and that takes staff, then we'll keep our schools open. So thank you, John. I appreciate it. All right. And here's something that's great. In the chat, our experts have been answering questions all evening. I think we've made quite a bit of progress, but they continue to elevate some things to me. So as we near our last 5 minutes or so, I'm going to try to answer some of those questions for you. Cleo, can you come back to the forefront?
Yes.
Okay. Hi, Cleo. I am back. Cleo, well, I don't want to ask you that because I don't think that's a very good, strong question for me to ask. And it's not one that you all submitted. It's my ability to articulate the question. Cleo, when we're talking about the quarantine period, would you mind going over that one more time, just to be clear? And I'm going to put the slide back up on the screen. I just need you to run through this one more time for folks.
Yes, and I do want to advertise the new quarantine and isolation page on our website that also includes an FAQ. We know that each situation can be so nuanced and unique to each family, and so we've tried to address as many of those situations as we can. And then we also have a full-time contact tracing team, and I believe Andre shared their email earlier. And so if you're experiencing a unique situation that you need the contact tracing team insight on to determine when it's appropriate to return, you should reach out to them and they'll respond. So the bottom line is that if you do contract COVID-19, regardless of your vaccination status, you need to isolate for a minimum of 5 days. Day 1 is the day after you test positive if you're asymptomatic, and day 1 is the day after your symptoms begin if you're symptomatic. And then you need to stay isolated for 5 full days. And you can only return to school on the 6th day. If you are unvaccinated and you are living in the same house with somebody who contracts COVID, you must quarantine. The timing of that quarantine depends on your ability to isolate from the person in your household who has COVID. So go take a look at our website and we have some guidance for you that will address the various unique situations families have when somebody in the household contracts COVID. And then if you're an unvaccinated close contact of a student or staff member who tests positive, if you are at the high school level, the guidance is still to quarantine for 5 days. We are working on a test to stay program for high school. I saw that question in the chat, and we hope to have more information for you very soon. But for now, an unvaccinated close contact at the high school level must quarantine for 5 days. But at the elementary school level, you can participate in our test to stay protocol and return to school. So I hope that helps, but I know it's complicated. So I just strongly encourage you to visit our website where you're going to see various resources and answers that hopefully will speak to your situation.
And finally, Cleo, we got a graphic coming out tomorrow.
Yes, we do.
So can you tell the audience a little bit about that?
Yeah, so we know that it's just been really hard for families. I have a little one myself, and I have been staring at my kids' school directions, preschool directions, trying to figure out when can we take him, when does he have to stay home, and we know that families are in that situation. So we have an if-then guide coming out that we hope will help you to, deal with the various situations that we all are facing right now. And gives you that information to know when you can send your child to school and when you need to keep them home for quarantine or isolation. So that will be out tomorrow, and we hope it will be helpful for you.
All right, Cleo, thank you for being great tonight. And thank you to all of our experts and my team here at Baltimore City Public Schools. Our goal is, after last week's event at the board forum, we heard the questions, we heard where you were at, and we want to make certain that we're conveying information, we're being upfront, we're being clear, and that we're being repetitive, quite frankly. There's a lot going on, and just because we say it on our website doesn't mean that everybody sees it. Just because we say it on social media doesn't mean that everybody sees it. Not everybody reads the emails that we send or the robocalls we send. So one of our commitments is, again, to be repetitive, to keep this information in front of you. As Dr. Santelises mentioned at the beginning of the event, we all want the same thing. We want our students and our staff members to be safe. Education is a priority. That's why we exist as a school district, to educate the children of this community. And we want to do it safely. And that means having the right protocols in place, the right testing, the right supports. As you look at the resources to the right, again, take one more good look at them. If you've got building problems, or you have a building concern, problems is a pretty strong term. If you have building concerns, send us an email to that email address and tell us the school and the location within the school. You won't hurt our feelings by telling us that something's not perfect. We'd rather fix it. If you have health and safety, if you want to see our protocols, go to that webpage, and I'm telling you, we're updating it as we speak, and that's not an exaggeration. So I want to make certain that we get to that. Wait a minute, we also have a question about spring break. Allison, can you come back to the forefront as I was sitting there prattling on getting ready to end the event? Allison, let's talk about spring break.
Mm-hmm.
Allison, what do folks need to know about spring break?
So I think the question has been about will we return directly to in-person learning after spring break, or will we have a transition with some virtual learning time after spring break? I think the answer right now is that we will watch community conditions and we will assess and decide. That's what we've done consistently in the past. So we meet with the health department every week. I meet with them and we go over the data. We talk about where we are in terms of community transmission rates and make decisions about whether we think it's necessary. So we have direct conversations with them about that, and they advise us on what they think is necessary. And so we'll have to see where we are. As we know, we keep up to date on where the virus is in the community and make decisions based on the current information. And that's hard to predict this far out, Andre. And so we'll just have to watch it as we get close to spring break and let people know as soon as we can. But again, it's going to be informed by what's going on with the virus at that time.
Thank you, Allison. I almost missed that. And I too care about spring break. So thank you for sharing for me as well. All right, guys, I've prattled on long enough. On our screen, you'll see a bunch of resources. Take a screenshot. We're also going to post this to YouTube, so tell a friend if you missed out on our event tonight. Watch it on YouTube. We'll continue to answer questions on these great FAQs that we're building out. And in the meantime, I am Andre Riley, your Executive Director of Communications here at Baltimore City Public Schools. Thanks for joining us, and y'all have a great evening.